Hi, my name is Sophia Stathis, and this is my Nursing 340 presentation on incident reports. So let's talk about what is an incident report. You may hear it referred to as a patient safety learning system, a quality variance report, or an unusual occurrence report. Basically, it's structured reporting, collation, and analysis of critical incidents. This is a form made by the nurse whenever an unintended event occurs. The form is submitted to the nurse manager, which is then forwarded to the risk manager. There is a list of common circumstances to report in box 8.5 in our textbook, but some of these include patient or client injury, unanticipated patient death, issues with medical equipment, significant adverse reactions. If you personally witness illegal, unethical, or incompetent practice, environmental emergency, and they now also recommend to report near misses or close calls. So why are incident reports important? They facilitate positive change by improving patient safety. It also allows for organizational learning from an adverse event. Whenever one nurse has an accident happen to her, she can report it and the whole hospital will be safer for it if they can facilitate a positive change by doing so. It also allows to monitor underlying trends of patterns for early detection. But the overall goal is to reduce preventable adverse events. Nurses are legally bound to report critical incidents to their nurse managers, agency administration, and the risk manager through the document known as the incident report. Now, the rate of incident reporting is relatively low. This is believed to be for several reasons. The nurses may feel fear or blame, or they may be scared that legal penalties will be taken against them. If there's poor safety culture in an organization, they'll be less likely to report. They may also just have a lack of understanding of what should be reported or how the reports are going to be analyzed or how they will bring about change. So to relate this to the AACN domains, we can talk about quality and safety. Now, the whole idea is to minimize the risk of harm for our patients, and we acknowledge that challenges of safety result from system failures. It's very rarely just the issue with one person or one nurse to cause a massive error. But it's important for the nurse to assume accountability for reporting unsafe conditions, near misses, and errors to reduce harm. If the environment you're in fosters quality and safety, you're going to be empowered and encouraged to promote safety and take appropriate action to prevent and report adverse events and near misses. They say that safety demands an obligation to remain non-punitive in detecting, reporting, and analyzing errors. So when we talk about the QSIN competencies, we can talk about quality improvement. The incident reporting allows us to monitor the outcomes of our care and assess quality of care through measurement and variance reporting. And then when we talk about safety, again, it minimizes the risk of harm. It allows us to understand performance and examine common practices and basic safety design principles. It's a process of understanding what caused an error in order to allocate responsibility and bring about that positive change to reduce the risk of the error happening again. And then these are some of the references that I used.